head the hospital in Mahalim. On my extreme left is Mr. Rohit Mahalim. He looks after the Intuitive, the company that provides the robot. He looks after the India business. On my left is Mr. Glenn Bovoso, who looks after the Asia Pacific business of Intuitive. And on my right is Dr. Vishnu Panigrai. Dr. Panigrai heads the medical strategy and operations for Fortis Healthcare, the complete chain. So, as Dr. Swapna spoke, this is about. So, first of all, Intuitive is the world's largest, soft tissue robo provider. Okay, they would probably have a cumulative share of 70-80%. Would that be right? So 70-80% of the world market is dominated by the Intuitive robo, and in North America probably it would be close to 100%. In India also they have a very significant share. The robotic surgery in India was started by Intuitive. So they have seen the kind of practice that we have, and they are designating us as a total practice observation site. So significance I tell you. So there are about 27 or 28 such sites in the world. Out of those sites, there are 9 in Asia, and we are the second site in the country. Okay, now what does it mean? How does it happen? So when they look at the total practice, which means the surgical practice, the other OT practices, how a patient is there, what are the patient flows. When they look at all that, they say that this is the kind of benchmark hospital, where other hospitals should come and watch and try and build a practice according to what a TPO is. So that is how we've been given this recognition, and we are really thankful to Intuitive for recognizing us as a partner and giving us this status of a TPO.
Namaskar, and just to what Mr. B. Singh rightly mentioned, आपको गर्व होगा कि that in the Tri-City, Fortis Hospital Mohali, they have a single console. After China, that was the second largest number of cases that hit on a single console. It is very credible. No metro, neither Delhi, Mumbai, Calcutta, Chennai, Bangalore had that. So the message is that you have a very good set of doctors here, very good, well administered, and the Fortis Health is trying to see that Fortis Mohali becomes, I would say, Mayo Clinic. Mr. Glenn is from USA. Like Glenn at the Mayo Clinic is in Rochester. It is not in the major city. It is way outside Minneapolis. So when you compare that with Mohali is way away from Delhi, and we are trying to create a proper medical hub. And with that, I thank the Intuitive Group where we are now having this partnership going forward, and that was rightly mentioned. So bringing enhanced quality into the system, and most important is that Gyan Bhatna chahiye. We should share knowledge. Knowledge sharing is because upskilling of everyone is important. Because if you go to Visit Bharat, unless you upskill people, there is no way that you will go. So you can't keep all the knowledge to yourself. If you have knowledge, please share it. So this sharing will be there, and the sharing will be done in a structured manner based on the processes that are shared by Intuitive on the TPO program. With that, I'd like to thank Mr. Glenn, Mr. Rohit for helping us put this in place. Thank you.
Thank you. Okay, one more thing I wanted to discuss is or talk about is what does TPO stand for? It means total practice observation. So it does not mean that we are a training site. It means that surgeons from outside will come and observe how our surgeons are operating. They will come and observe how the OT nurses work in coordination with the surgeon, how the technicians work in coordination with the surgeons, and how patients are handled before, how patients are handled after the surgery. So it is the complete gamut of hospital operations that a TPO covers. It's important to understand that we are not certifying or validating any surgeon. It's just that people come to see well-tuned, efficient, and state-of-the-art OT